Good evening, everybody. Thank you so much for joining us. Welcome to Healthcare for Action Town Hall with Congresswoman Maxine Dexter, Lauren Underwood, and hosted by Healthcare for Action and Dr. Dua. Dr. Dua will be joining us shortly. She has had a patient emergency. She will be right back. But in the meantime, we are going to get started with stroke survivor Tim Rafferty, a resident of Boston. Tim's going to share his story, and we will take it from there. Okay, Tim, thank you.
Yeah, thanks, Meg, and thank you all for having us here. This is my wife, Allison, alongside me. And again, thanks for letting us be a part of this. But yeah, I just want to share kind of my story. About 7 years ago, 2019, it was a ordinary day to me, at least. And I went to the gym and doing some light exercise. All of a sudden, I got real dizzy, disoriented. I went to sit down and I caught somebody's attention from the other side of the room, and the look of horror on their face kind of brought this anxiety, anxious kind of sense to me, the fact that, okay, there's probably something seriously wrong. At that point, I felt like my face was sagging and dragging on the ground. I couldn't move the left side of my body. And ultimately, I had, soon to find out, I had suffered a hemorrhagic stroke. At the time, I was pretty thankful for being in public and around people so that they noticed the symptoms. They got a hold of the EMTs and the medics, and they took me to the Brigham in Boston about as fast as you could possibly get there. And if you have some familiarity with stroke, time is of the essence, and it's critically important to receive attention as soon as possible. Upon my arrival there, I couldn't believe the amount of people. It was organized chaos. I thought that all of these 20-something folks there in the ER bay waiting for me in the ambulance bay were there for other people and other emergencies, but no, it was just dedicated to myself. And I'm incredibly thankful for all of their efforts that day. And shortly thereafter, that's when they had kind of broken the news to me that I had suffered a bleed, which is a hemorrhagic stroke. Upon conversing with the doctor, it was said that I may never walk again. At that point, that news, as you can imagine, trying to kind of stomach that, going through what you're experiencing as a patient, you can't walk, you can't move, you can barely talk. And somebody just tells you that you're probably never going to walk again, and the recovery maybe doesn't look so good. And I was fortunate to, through the attention of the hospital staff and observation throughout several days, I was able to kind of prove them wrong in the sense that I was able to start with kind of fluttering a toe. And then the next thing, it was the foot, and then it kind of worked its way up. But if I can backtrack just a second, there was a moment in the ICU. This was shortly after they had kind of delivered that news to me. And they had said that, or asked me about a DNR. And at that point, I thought, well, if I can't walk and there's clearly concern about my stability here, maybe I'm okay, signing for that. And that ICU doctor, within reason and within his boundaries, had kind of talked me out of that and had let me know that, look, there's kind of went on to neuroplasticity and what this is all about, and really kind of instilled hope that things could hopefully turn around for me. And in fact, they did. And so throughout my stay there at the Brigham, things started to move along. They got a little bit better each day. And while I was there was all this talk about this wonderful rehab facility within Boston, Spalding Rehabilitation Hospital. And I was thinking, gosh, I really want to get there. And there was a lot of challenges, whether it was paperwork or signatures, or whether there was a bed available, or whether I was um, in the right kind of stage of my recovery to be able to go there. And there's all this kind of anxiety along those lines. But ultimately, things kind of had worked out through a significant amount of effort on really my wife and my mom, who were advocating for me at the time. And had I not had them by my side, I'm not sure where things would have ended up for me. But I had a long inpatient stay at Spalding, and slowly but surely started to make recovery. And I was able to kind of shuffle my feet with a walker, and then move on to a cane, and then shortly, thereafter, I was walking on my own. And but all of that didn't come without the effort and time. It was probably, almost a year. I think I was in inpatient and outpatient rehab in order to achieve the kind of recovery that I've had. And even since then, I think I've still made strides here 7 years later. I described like the feeling that's kind of left on my left side with my fingers. It's like I almost have rubber bands kind of strapped around them. And over the last few years, I've noticed that just by continuing to work with that, things have gotten a little bit better and a little bit better. So I feel pretty fortunate to be, where I'm at today.
I think Tim is being a little bit humble when it comes to his recovery. He's gearing up to run his second marathon, Boston Marathon, on Monday. So not only, did he come from a place where someone had told him you might not ever walk again, he's running 26.2 miles now twice. So he's come a long way.
Okay, I have to unmute. That's insane.
Yeah.
Actually, so that's how
Yeah.
I found out about Tim's story. So everyone, hello. My name is Anahita Dua. I'm a vascular surgeon at the Mass General and the founder of Healthcare for Action. And it's my honor to have Tim, Allison, Representative Maxine Dexter, who is also an ICU doctor, Dr. Dexter, and Lauren Underwood, who is a representative out of Illinois, who's a nurse with us today doing this amazing work. And I really thought, the best way to start this out is to talk about patients like Tim. So, Tim, I want to ask you and Allison something before we jump into talking to the representatives, because it is so fundamentally important that the conversation around health stays around patients. The problem that we've had in messaging around healthcare is we keep talking about money. Oh, Trump is doing $1 trillion tax cuts. Oh, what are we going to do if we don't have premiums, that are changed? That's fine, but a lot of people don't understand what that even means. And what it means is people like Tim die. That's what it means, to be frank. And so what I wanted to do to bring Tim and Allison on here, who are great friends of mine, and Tim is a great story. The reason Tim is on here is to tell you that every American deserves Tim's story. And the thing is, in the United States of America, and the richest country in the world, we can do Tim's story for every single citizen. That's not a pipe dream. That is something that can be done. But without the right logistics, without the right people in office, like Representative Underwood, like Representative Dexter, we will never do it. And actually today, we are sicker as a country, and more people like Tim. For every 100 Tims that are out there, 80 of them will not make it. And the reason for that is not because the surgeon wasn't great or the hospital wasn't nice or the nurse wasn't good. It's because the system cracked. And somebody like Tim would not get to the ER in the right amount of time. The ER would say, oh, we're full, we're sorry. Or Tim would be in a place like New Hampshire where these hospitals are now going to close. And by the time he would make it to a place where he could maybe get care, it might be too late. So with that, I just want to come back to Allison and Tim and just ask one question to you. You have done this incredible thing. You are running that marathon. It's just amazing to see. But as you think back at your story, what were some of the pain points that you thought you couldn't believe this was happening in the US? And where do you consider yourselves, quote unquote, lucky in that this all worked out, but maybe it couldn't have had this one doctor not done this or had this one hospital not done that?
Yeah. You want?
Well, I mean, I think we've been thinking about this since you've asked us to be a part of it. And, at the time I was just Tim's girlfriend. So he was not my full responsibility as he is now. His mom was a huge, huge, advocate for Tim at the time. And she really acted as his administrative assistant, essentially, kind of combing through all of that administrative burden and paperwork that kind of was dumped on his lap. So you're thinking like something catastrophic happens to you like this, that you just have to focus on your healing. But it's not the case. You have this whole other side of things, which is, bogged down in minutia and paperwork. And it's not just a one and done kind of thing. There's many different channels that need to be done. So you're talking about admissions to the rehab, inpatient to outpatient, insurance claims, the inevitable denials. It all takes a lot of work. It takes persistence and a certain set of skills really to understand the paperwork and what needs to be a part of it. And then, understanding the urgency that there's a deadline, right? And you have to be organized to keep everything, moving and meeting those deadlines. And also his mom, being a nurse for many years, had an understanding of the health network and the care team and, kind of like the hospital culture of, okay, I'm not going to bother the nurses. They're too busy. It was kind of funny because it was around Halloween, I remember. And I think she was pretty much bribing hospital staff with Halloween candy, right? She's like doing whatever she can, like waiting around corners because you have to have your doctor's sign. Not only do you have to fill it out, but you have to have that signature. So it's knowing that, I'm going to see the doctor during rounds and I'm going to have the pen and it ready for it to be signed because that's my only opportunity. So not only do we care about Tim and making sure he gets the help that he needs, but there's this whole other administrative part of it that you need to be on top of if you want to be getting into the Spaldings of the world, which is like the NASA 4 seasons of rehab centers. So we knew we wanted Tim to get in there. So his mom was doing whatever she could to make it happen.
And I think
Yeah.
that is where perfect segue into Representative Dexter and Representative Underwood, because they are the doctor and the nurse of our country, frankly, right now. And they are the ones that help you with that, the quote unquote, exactly like you said, the paperwork side, that a patient can just focus on healing while our system supports them to do what they need to do. So with that, I thank you guys so much, for telling the story. And I again, a lot of these town halls start out with the sad patient. Oh my God, this happened to me. And, I lost my leg or and it's so important to show everyone here what we can do. You are landing on the moon. That's what happened here. And every single patient deserves that. And we can do it, but we can't do it without politics doing the right things for us. And, as a doctor, I will say that, I just want to operate. I have no interest in doing anything but being in the operating room, but I've been forced to come to this position because of all the Tims that I treat. I go and I do a 6-hour procedure, I do this or I do that, and then we're right back into the world where ultimately he has a bad outcome, even though I did my job because the system failed him. And that's what we're here to talk about today, the system. And with that, Representative Dexter and Representative Underwood, I'm so honored and thrilled to see you here today. Thank you for coming. Before we begin, I'd like to just have each of you introduce yourselves and just tell us a little bit about, I know Representative Underwood, you've been in Congress a long time. Representative Dexter, that you've just done the first 2 years, I should say. And now, obviously, you're going to be there for a long, long time as well, I hope. So can you please tell us your perspectives? First of all, why you joined and what you saw when you got in there and what you see coming down the pike. And we'll start with you, Representative Dexter.
Great. Thank you so much, Dr. Dua, and thank you, everyone. And Tim, what an amazing story. So it's just truly an honor to get to follow your very, very strong lead here. Maxine Dexter, pulmonary and critical care is my background. I'm from Oregon, very honored to represent the Portland area out to a more rural area. I absolutely... it always feels like I'm diminishing being in Congress when I say, like, the thing that fills my cup, the thing that has always given me the most satisfaction is taking care of patients, taking care of people. But the fact of the matter is that when I was trying to take care of people, the system was exactly the problem. We would admit patients, in extremis, either from, for any number of reasons, whether it's a neuro ICU patient who just had a procedure, or a patient who is dying from exposure, or people who are withdrawing from whatever substance they have an addiction to. Obviously, it goes on, but the system could not then take them to the step to keep them safe and healthy. And when I'm sitting in clinic recommending a CT scan for their routine follow-up on a nodule, or medications to take care of asthma, and patients are making impossible choices about getting that recommended treatment or assessment, or paying the rent, or paying for their childcare so that they can keep working. These are impossible decisions that people should not have to be making in the world's richest country with the most sophisticated healthcare system. And so, I have two they're not young, they're teenage children, young adults. They deserve a world that we had, or better. We should not be fighting for what we had, 10 years ago. We should be fighting for what we deserve. And the fact of the matter is, patients have never been at the center of the system that we've created. It has been designed by folks who don't deliver care or receive care, or at least that's not the lens that they used when they designed it. And so the incentives don't align with the outcomes that we need of keeping people healthy and getting them access, and making sure that it's not just accessible, but that it is high quality and patient-centered. So came to Congress because, I was tired of working in a system that continued to fail people. We were doing all the things we could, but not getting the traction that we needed. And I was in leadership at our medical group and had gotten lots of business input or understanding around the healthcare payers and all that. And I just felt like, if not me, who? And so really honored to serve with Representative Underwood, who has been blazing trails and doing this work. And so I will yield to my colleague.
Thank you so much. Really appreciate that. Representative Underwood?
Well, thank you for having me. I'm Congresswoman Lauren Underwood. I represent the 14th Congressional District of Illinois. I'm a registered nurse with the Master's in Nursing and Master's in Public Health. And I, discovered healthcare policy very early in my career. And so have been on this path, not necessarily path to Congress, but in policy for a number of years now. I decided to run when I attended a town hall meeting, and my congressman was not honest about his intention to vote to repeal the Affordable Care Act, which would jeopardize the ability for people like me with pre-existing conditions to be able to get affordable health care. And so, that was the animating issue of the 2018 cycle. I was able to bring my experience as a nurse, bring my experience as a person who had ACA coverage with a pre-existing condition, you know what I mean? Just like to relate with the community on the issue that was most important to them. And I won. And so I'm now in my fourth term. And what I've seen in the Congress is that, healthcare remains an animating issue. It is a source of deep division in a Trump presidency when he has made it so clear that he does not care if the American people have any health care, much less affordable health care. And he continues to take action through policymaking that puts, great health and well-being and optimal health status, out of reach for hundreds of millions of Americans, to be honest with you. I mean, the cruelty is the point when you try to take $1 trillion out of Medicaid and refuse to extend the extremely popular ACA tax credits. So what do I see coming? I mean, I think that a lot of the 2026 midterm election will center around healthcare and what people see happening in their families, see happening in their communities, and where we hopefully as Democrats can articulate a path forward that people can be excited about, that would make healthcare more affordable, and the disparities that so many of us encounter.
Thank you very much. I love hearing that, because it's so good to hear it from people who are in power saying that, these are the things that we want to focus on. And with that, now for the next 30 minutes, what I want to do is we've got some question and answers that the registered group here has put through. And I wanted to speak to you about three really big things that are the themes that have come through with the questions that have been submitted. Number one is your desire. So if you had it your way, you're in Congress, you're a Democrat, what do you see? What do you wish for? And how, secondarily, do the Democrats message around healthcare? Because, and I'll ask you these questions specifically, I just want to give you the themes. Because one of the problems is kind of as we started out this conversation that, again, we keep talking about healthcare in terms of money and not in terms of people. And it's been really difficult for people to really understand. One of the reasons, Hegseth and Kristi Noem and all these other people are getting attention when the real kind of killer right now is really RFK with some of the behaviors that are going out there with vaccines and some of the misinformation. But it's almost like hypertension in that it's the silent killer. You don't feel it until something bad happens. And so and then the third piece is the action. This is a town hall for action. There are a lot of healthcare workers here. What can they do in their communities to actually make a difference? As we know, these things are coming down the pike. So with that, I'll ask the first question. If you had it your way, Representative Underwood and Representative Dexter, what would you want to see as healthcare for America?
Well, I think number one, we have to get back to like neutral, and neutral's not good. So I want to start out by saying like, undoing the Medicaid cuts isn't something, it's something that we obviously need to do, but then we need to build on, right? Like restoring the ACA tax credits, we need to build on. We need to make sure that people who lost their SNAP and access to healthy, nutritious foods can get that back. And so, that absolutely has to happen as quickly as possible. And it will be a fight. Okay. And so let's not delude ourselves into thinking that like that's done, it's in the bag, it's really easy. No, 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 it's going to be a fight to get that done. And then we're going to have to fight even harder to make sure that we can move further. And so, I have a lot of healthcare bills. I have legislation to make sure that we're ending our nation's maternal health crisis. This week is Black Maternal Health Week. And so we're talking about taking action to save moms' lives. And every zip code across the country, we've seen this crisis rear its ugly head. And we see this, it's really dual, right? Maternal mortality and morbidity. And we can, through investments and policy change, take action to fix both. I also, just to your point around cost, we've really become pretty laser focused on trying to address healthcare costs because that's what we're hearing from voters. And that's the opportunity for us to have a conversation with them around the larger set of healthcare issues, meaning access, quality, disparities, research and innovation, right? Cost is what opens the door, what opens that window of opportunity. And then we can do the other things. And so, we haven't forgotten about the NIH and the need to rebuild our research infrastructure. I have a lot of legislation to support the nursing workforce, which has just got a gut punch with this Department of Education policy to cap access to student loans. And so, there's just like a lot of that stuff that we need to do. The visionary part looks like, that healthcare provider not having to mortgage their entire future to take care of their community. There's a lot of work that we can do just on our approach to workforce as the baby boomer generation retires and enters old age, where there's a lot of healthcare utilization. Let's phrase it that way. There's a high demand for providers across the country, and we need to train and educate that workforce. And we need to break down the barriers to doing that, not reinforce them like the Trump administration's doing. So there's a lot to do, Dr. Dua. I'll turn it over to Maxine Dexter, a visionary leader who has, through her perch at the Doctors Caucus, helped to mobilize the Dem healthcare providers. And I thank her for her leadership.
Yeah, thank you. I absolutely love the way that Representative Underwood is true about what's going on. Like, we've got to be honest. We can be aspirational and really focused on what the goal is, but the fundamental issue is that this is not going to be easy, and we are going to need every single person on here and across this country to not just expect that we all are going to figure it out. We're going to need folks leaning in. So really appreciate that. What I would do if I, had a magic wand and could make everything work out, we've got to deliver affordability. And that's not just for the patients, like their out-of-pocket costs are far too high, 20, 30% of people's income. It shouldn't be more than 8%. And that still seems high, 8.5%. We need it to be affordable for the systems, our hospitals, our nursing homes. Like in nursing homes, we can get into, but that's complicated also. But there are so many, like the system costs too much. And it's because there's perverse incentives. We're not incentivized to keep people healthy, and public health interventions and getting the middlemen who are vertically integrated and shell gaming the money around to line the pockets of their shareholders rather than going back into the system is part of the problem. So affordability for the people using the system, as well as the sustainability of the system. We got to build capacity. Like, we do not have enough healthcare workers. We all know this. Like, we also need to let people, I believe, and I know these may be fighting words in some circles, but people need to be able to practice at the top of their scope. And we need community health workers, and we need social workers, and we need nutritionists and pharmacists, and people who all are enabled in the system to actually practice and not be nickel and diming or widget counting the visits and who can bill for it. Like, we all need to work together and do the best possible things we can for our patients. And we know, nurse visits after a mom delivers makes a really big difference, because they can see how things are going and make recommendations, rather than making that new mother like tote that child to the clinic where they sit for an hour in a measles ridden or other setting. So we can do better. And then challenge corporate power, man. We've got monopolies. We've got vertical integration. We've got the Uniteds and the Optum. Well, United and Optum are the same, but we have so many challenges because there's money to be made in this system. The private equities, like in Massachusetts, this probably rings too close to home, but we have to break these private equity and corporate investments out. When they're investing, there's money to be made. We got to get rid of those incentives.
I love it. I love it. And God is so right. So I'm going to do something a little different here with some of these questions. So, when we talk about this as Democrats, it's very easy to rattle off, these are the issues. We know this, we know what the cuts and, so let me ask you this. What can we do? Genuinely, keeping it real, just like Representative Underwood started out with. I like that. That's exactly what Healthcare for Action is all about. Just straight talk, because if you don't know the enemy, you can't do the fight, because, you're talking up here, like you said, in the vision, and you actually don't know what you can actually do. Now that things have gotten so terrible, and I agree totally with what you said about kind of getting back to neutral. We're so behind the 8 ball now that even the crappy stuff that we had going on 10 years ago looked better than what we are at right now. How do you two believe Congress can really combat, with all three branches of government over on the Republican side? And unfortunately, and it's not the Republican colleagues, that's not the problem. It's the Trumpism aspects. How do we actually genuinely on the front lines combat this?
Okay, so I think let's just start out fundamentally. Number one, we have to win. We have to flip the House. We have to flip the House with a big enough margin to let us take these big swings, right? So if we flip the House and we have a 4 or 5 seat majority, we will celebrate that. That's not enough. A 4 or 5 seat majority doesn't let us fix Medicaid and do the rest. That's just me. Maybe I'll be surprised, but I don't think so. And so we need a big majority, like we had when I flipped my seat in 2018, and we flipped 40 other seats, and we had a big majority to do the big things. Number two, we have to flip the Senate. Like, we have to be serious about it. That's how this gets done. It's not enough to just flip the House and then assume that the senators are going to get on board. That is not reality. Number three, when we talk about undoing all the damage from the big ugly bill, that will be a cost. It comes at a financial cost. And so that means that we will have to raise taxes on the rich. So, like, undoing the tax breaks that the wealthiest Americans got under the big ugly bill. And then we will have to raise those taxes even higher, because we will need revenue in order to pay for all the other things that we want to do in healthcare. Real talk, that gets to be really tough, because there's going to be a lot of big interests against those revenue options that we have on the table. And an organization like Healthcare for Action, just as an example, may not be built around like a tax the rich concept. But we can't do the healthcare things that we want to do without money to pay for it, right? Like at one point in time, this is the real talk conversation. At one point in time, we used to be able to do things and just put it on the credit card. But now Trump took us to war. They're spending billions of dollars a day. He came and asked for 200 billion just after being at war for a month, right? Like that's coming out of our healthcare pocket in a literal sense. And so I don't want to dampen expectations. I want people to be ready for the fight ahead. We have to be warriors for healthcare equity. We have to be warriors for healthcare justice. Like we have to be, and we have to be ready to take the punches and throw the punches in order to transform our healthcare system. But the idea as if it's just going to be a fight on the merits of healthcare issues, I think is a little bit misguided. And then when we are being attacked by our Republican colleagues and their big moneyed interests that support them, it also will be a challenging endeavor to navigate. I will just end by saying this. In my first term, we worked on a surprise billing bill to try to get rid of surprise billing, sort of like the junk fees that were really just causing so many families to have financial distress because they thought they were going someplace in network. And it turns out the ED doc was out of network, but the hospital was in network. And how are they supposed to know in an emergency, right? We were confronted with significant opposition that flooded my district with television ads, mailers, digital ads, as if Lauren Underwood, your local nurse, is trying to destroy your healthcare system because it was messing with the pockets of the big moneyed interests. And my constituents got outraged and confused. They believed that misinformation that was coming their way. And so we have to be organized and activated in these organizations as well to defend the policy changes that we seek. It's not enough to just educate people, right? Go on, do these Zooms, go on TV, whatever. No. We're gonna have to spend money, raise money, and do that hand-to-hand combat. It's gonna be tough. I think we can do it, but we're just not in that position right now.
May I ask you a question then, just before Dr. Dexter jumps on, that actually came through, because that's a great. So one of the questions, interestingly, that was asked is exactly what you just said. Trump came and asked for this money to go to war, and suddenly out of nowhere, these billions of dollars appeared to go shoot these missiles. Where is that money when we are talking about health? Because that seems to be part of the issue, exactly, that we're saying, okay, now we need to raise taxes in order to pay for this healthcare. But is the money kind of segregated? Because people don't know enough about Congress. Is this money that we just can't tap into? Like, where did this guy even get this stuff just lying around to go and bomb it? You know what I mean?
We have
So
no
how do we
idea
explain that?
because they don't tell us anything. You know more reading the New York Times than we know and sitting in these classified briefings with these guys.
Jesus.
They do not follow the law.
Mm.
They steal money that's intended for other programs to use for whatever it is that they want. And right now they're using it to bomb the Iranian people. And so, there's no like secret slush fund.
Mm.
Okay, we gotta really be clear. Not at DOD. I mean, unless Maxine knows something I don't know.
No, but they've got all these tariffs. They've got a huge slush fund that we don't know what they're doing with those dollars.
Yeah, that too. Mm-hmm.
See, that's the kind of stuff that the public really needs to know, because it's a lot of confusion, because it's interesting, because the Democrats are saying the stuff about the tax, and exactly like you said, we need to know, of course, we need to fund the healthcare system, and simultaneously with funding it, as was said by Dr. Dexter earlier, we need to figure out a way to make it affordable. Does a CT scan need to, I just saw the other day, somebody, got their appendix out, $20,000 bill, but the 20K was just what they owed, not actually what the bill was. Which is absurd, obviously. So it's kind of both things. And so it's really good to hear you say that so clearly, that we have to put money into the system and figure out ways in which to message. And I totally agree with you. People don't go to the voting booth for healthcare because it's too out there and confusing, but they'll go if they understand that their SNAP benefits will come back, and that they'll get to have affordable care and all these other things. Dr. Dexter, what's your thought?
Yeah, so number one, people do go to the voting booths for healthcare. Like that, you're right that it's an existential huge thing, but people want access to healthcare that doesn't put them into bankruptcy and all these things. So we know that that is an activating issue, and I say that because you all are taking care of folks who are so grateful to be in your office, and yet like they're scared when they come because they have no idea what you're going to find, how much it's going to cost, like whether or not, you know, people should not have to fear going to see a clinician, you know, full stop. Like this is absurd that this is where we're at. So Lauren like broke down absolutely. We have to win the House, we have to win the Senate, all those things. We have to have a real conversation around being strategic and also being effective as a caucus, as a nation. We cannot, and caucus is the Democrats in the House and the, you know, I forget sometimes it's kind of like using slang or anyway, I'll stop. We have a real need for a strategic plan that is detailed for us, for the policymakers, for the people who know how the system needs to work, that we do not try to communicate to the American people all of the information. What they need to know is whether they're going to be able to see their clinicians, whether they're going to be able to afford the care that they need, whether or not there's going to be enough clinicians. Like we're seeing a huge loss across this country right now, and now we're capping student loans. Like people need to know that we are going to create a system that they actually can access. And yeah, the taxes are almost assuredly going to have to go up. But if you add up your out-of-pocket costs and your copay, you know, your copays, your deductibles, your premiums, like it's going to be less than what most people are already paying. And it just is going to be standardizing benefits. And I will just say, Medicare for all is a very important talking point. It's something people understand. We have Medicare. People, you know, look forward to their Medicare, and all of you know, Medicare doesn't work perfectly. Medicare for all, I believe we need to be fighting for a healthcare system that's affordable, accessible, universally standardized in benefits and all the things. But it may not be a single payer. It may be other options. Like I just encourage people to not get stuck in Medicare for all is the only option that makes sense, because we are probably going to have to deal with the fact of the matter is that people didn't want to give up their insurance companies. Those 28, no, it was before that. Anyway, there have been ads that really attack people's choice. So in America, like people want to have an option other than that. And the last thing I'd say is I was all in on a single payer federal health program. You know, when I was in Physicians for a National Health Plan and doing public health stuff and everything a long time ago. I don't trust our government to have all of our information and to be able, we have seen in this administration how easy it is to break things and burn things down. I wonder about the wisdom of putting everything into one basket. So there's a lot of discussions around the how. I think the ultimate decisions that we need to make are, we've got to take the perverse incentives out of the healthcare system. We have to make it administratively simple. The global budget idea, if we just took all the money that we are spending in healthcare right now and actually used it wisely, we actually have plenty of money in the system. It's just that it's going to be hard to break that up and get it to all the right places. So taxes are going to have to change almost assuredly, because people are putting all that money into the system too. Like if you don't want people to pay out of pocket, but that's helping sustain the system, like that's the only way the maths. And if we don't get something done quickly, our healthcare system is imploding. So we have to stop the bleeding and then do the aspirational stuff. So 2027, do all the things Representative Underwood is already talking about to stop the bleeding. And then let's get to work on the next steps, probably in 2029. And it's not going to be like an overnight sort of thing.
I love that you said that. That's so true. This is not a quick fix at all. You know, I mean, it's very easy to walk into my office and smash everything, but it'll take 100 times longer to rebuild and rebuild properly. And unfortunately, the Trump administration, I mean, it's very easy again to just, destroy, very difficult to create. And so that is a great segue into this next really good question. So, we've talked about what is kind of coming down the pike and what we need to do to right the wrongs, but we are in the wrong right now. So next year, one of the questions is, recently 2 hospitals have closed in one of our attendees communities already. So not even, what's coming up, but already closed. And with that, there's been increasing pressure on the specialized hospitals and the acute care hospitals, like the one that I'm in, for example. So are there any federal strategies right now? The bleeding is going on, as you pointed out. Is there a FemStop or something that we can put on it just to get through this? Or are we really going to see the numbers that have been put out there of the thousands of people that will die because of access issues? What can the federal government do right now in its current state to help those people where these community hospitals have shut?
It's really such a good question. Thank you to whoever submitted it. I have a bill. It's called the Prioritizing Rural Healthcare Act. My district is half rural. Okay, like rural remote gets to be like your cell service doesn't work, and we're like Chicagoland, so allegedly. And but we got corn and soybeans, and incredible pumpkins. Y'all are all welcome to come and visit in the fall. Okay, so. What we've seen happen is that our rural healthcare infrastructure closes. And then when a company or organization wants to come in and reopen that facility, they're not able to get support from USDA, from their rural development side, to help, spruce up, bring things back up to code so that they have an easier time reopening. We had a hospital close in 2023, and then someone else came in 2024 and wanted to reopen it. And they had to spend $10 million to upgrade this hospital after it was closed for just a year. It is crazy. And that's what really prompted me to write this legislation. That hospital is competing with every, Main Street small business in that small town, is competing with every, ag related economic program, and the hospitals and health centers aren't getting the money. So the person who wrote the question may not be in a rural community, and my solution through USDA wouldn't necessarily solve every closed hospital or unit's problem. But just to say, I think we need to start really putting an emphasis on not letting our healthcare infrastructure decay, so that as we look towards the future with, again, aging folks who are who are using a lot of healthcare services, are going to need space, inpatient space too, especially after all the nursing homes that are about to close due to the Medicaid cuts. They're going to need inpatient space, and that will require federal investment.
Yeah, and I also have been spending a lot of time talking to people smarter than me in this area, and the fundamental truth is, we need a federal investment, and it is going to be a too important to fail sort of moment. We've saved, the banks, we've saved the car manufacturers. We've been in moments where we've had to have an infusion of cash to save a sector of our economy, or an important part. If there isn't an important role for healthcare to be saved, I don't know, why we would be prioritizing the banks or the car companies over them. So we have to come up with it. We've come up with it to go to war. We've got to come up with the dollars. And I worked in Oregon. I was at the state legislature. We were working really hard to pass different bills to prevent mergers and acquisitions, and to make sure that there was safe staffing, and to make sure that we protected physician groups from private equity, like monopolizing their professional sort of autonomy. And that is all kind of the same sort of steps we need to do, but we probably need to do it at the federal level. And I think you got to stop telling physicians and healthcare delivery systems what they can't do. You got to trust the doctors, and no offense to any other clinician, but doctors are accountable for 82% of the healthcare expenditures in the system, because we're the ones prescribing the different things, or ordering the different things, doing the procedures, and choosing which one. We have to be trusted as professionals and then held accountable for outcomes rather than all the administrative hoops and red tape and prior authorizations for something that you have to do. Like, we have to liberate that. And I think if we give people options of, you can practice in this environment, we're going to give you capital, you've got to use a formulary, you've got to take care of all these patients for this kind of reimbursement, I'm guessing that groups will choose a simpler system where they can be the professionals they are and have, a salary, or, they have to take on the risk for their own little clinic. Like, this is happening in rural clinics across the country right now. They're making ends meet on Medicaid patients alone using capitated payments, more or less. Like, we can trust the system to do the right thing if we just hold it accountable for the outcomes. Like, you've got to take care of these people and they've got to get their vaccinations or whatever it is. If we trust doctors and we trust the system and we get if we get out of the way, we know that we can do better. Like, we all ran free clinics and did things, on a very slim budget because we cared about taking care of people with, foot ulcers or other things who are houseless in medical school. Like, almost all of us did something like that. It is absolutely the case that people go into healthcare because they want to take care of people. Not a single one of us wanted to fill out more forms, and that's why we spent all this time and money getting trained to take care of people. So the rural investments that we need, urban underserved areas as well, we're going to have a pot of dollars with some rules and how we're going to save you and get the private equity and others out, because they're looking for a lifeline. And if the only one coming is from a private equity firm that's going to then sell up to United and consolidate all the power, we've got to diffuse that and break it up. And I think that's one of the only ways. But I haven't even talked to Representative Underwood about that. She probably has some other thoughts that maybe I'm totally on the wrong track, but I think we've got to save the system, and it's going to take an infusion of cash.
I'm seeing a bill getting written between you guys. That's what I'm seeing, like something amazing where you can write all this down. And this is a great segue into the next question. By the way, you can say fuck all day long. We're talking about healthcare. Are you serious? Like, if you don't use the word fuck to describe this situation, what is it used for? But basically, here's the question that came through about what you kind of just said. We've talked about what the problem is. We've talked about what the solution would look like. And agreed, if right now we waved a wand and everything that came out of both of your mouths occurred, we would be 100 times better than we are currently. Now the how. And what I mean by that is, we sometimes see, now you're obviously an ICU doctor, she's a nurse. Obviously, you've lived it. So you go into Congress and you can say, these are the unintended consequences of this decision that you guys are about to make. People listen to you. But even people with great intentions who are there, who just don't know anything about anything, because healthcare is so complex. We all know that, being in it. How can they make the decisions that you just described intelligently in a strategic fashion to allow healthcare to be what it needs to be without really understanding the system? And what the buried question was in this is, do we need expert panels, or who goes out there and says, these are the 100 problems we have in healthcare? This is how, from the pyramid way, we're going to fix it. How are you doing that in Congress? Besides just this haphazard, we need to stop this or we need to start that. What is the actual strategy that you would employ?
The representative is in leadership, so she probably has more understanding on. I have lots of ideas about the work behind the scenes, but ultimately, if leadership isn't on board, it's not happening.
That is the honest truth. What I was going to say was that, number one, please do not assume that Republicans have the same value set as Democrats. And so, they don't generally have a data-driven, evidence-based approach to policymaking. So do not presume that they're trying to actually solve that problem. Okay. I think secondly, we also know that there was a comment in here about healthcare being a human right. They don't share that fundamental value either. Thirdly, they don't value facts and the truth. So they're not asking the question to understand the impact because they don't necessarily care about what that expert would have to say. And so my suggestion as brilliant advocates gathered today, if you wanted to do something really constructive, maybe work on a menu and give Congress kind of a menu of fleshed out policy options to choose from, A, B, or C. You know what I mean? So, like, here's an example. Today, I had a conversation about raising the minimum wage. And it was like, do we do 15, 18, or $20? Great. Like, let's have a really focused conversation in that way instead of saying, like, just debating endlessly the merits of raising the minimum wage. You see what I'm saying? Like, it's better for us, in my opinion, to have a focused conversation among a few pre-vetted options. And I think that would help expedite a solution. If you believe that you can come and pull together a briefing and have some charts and walk through projections, and that would be enough to get the United States House of Representatives to find consensus, I wish that were true, but unfortunately, that is not the reality as I've experienced it.
So yes, she is absolutely right. And I do think that this is the problem that is going to take a really dedicated, like, the devil's in the details. And so, I'm a freshman, aspirational. We have a national group of leaders who have been doing healthcare roundtables with us. We have some proposals. We're working through them. I know there's probably going to be 8. I've got the solution to fixing healthcare options, which is great, because then we get back to what Representative Underwood just said. Like, let's look at these, like, organically sort of constructed options. And what I'm finding is that we had a Project 2027 group who were healthcare leaders in Oregon, who were sort of on their own trying to come up with the solutions. And then I have this group here with, leaders from across the nation who are coming up with a solution, and they're almost exactly the same. So, and that is not with, I've tried to not bias, all the things. I think there is some consolidation around what the options are, because the monopolies have become so powerful, and the perverse incentives are so clear at this point that I don't disagree with some of Representative Underwood's skepticism about our Republican colleagues, but there are some very clear alignments with the GOP doc caucus. So I'm one of 6 Democratic doctors. There's also a GOP caucus. We have we're actually doing bipartisan conversations. There's a lot of things we all agree on. So I do think if we want durable policy, we have to have policy that both sides are sort of willing to try and commit to, because otherwise we're just going to do this pendulum swing unless we win so compellingly and start doing the work and proving to the American people that we can actually address their issues and win their trust, and then win for 20 years, which has happened before when Democrats did big things. We need to actually deliver. We can't just talk about it, maybe have a couple outcomes. Like, we have to do things that people feel they can see that their lives are better and that they trust us to keep working on it. If we don't do that, we're going to fail, and we're going to keep this pendulum, and everyone's going to keep swirling. So we got to win big, and then we've got to do the work that the American people are counting on us. And if we don't, they're going to go back and look for change again.
I love that. I mean, that is such a beautiful way of putting it. And you know what? It's so medical what both of you said, right? Patients don't give a shit if you walk in their room and explain their pathophysiology to them and tell them that, these are the things you could do. They just want to be better. And you're exactly right. The American public, we all feel it. You guys are even saying it yourselves. We just got to do the work now and actually do something actionable. I really love what you said about, give me the menu. Like, what do we need to do? Because exactly, that's what all the doctors on this call and the nurses on this call and the PTs and social workers are all here to do, like, to figure out how we can help. And really, there's two big ways. We ensure that you keep getting elected again and again. And we're going to have all the information out to the group about your website so that they can go and see the work that you're doing, because we have to keep you guys there. And the second big thing is, of course, that we need to get involved more aggressively and give you that menu and help you then take and put things into action. Ultimately, you are two people that are in this body that represents the United States people, and it's our job to tell you what we would like you to please take forward. And we're so blessed and grateful to have you guys where you are. And it's now 7 p.m., so I won't take another minute of your time. But I promise you, from our side, the American people, we will deliver that for you. We'll go to the voting booths. We'll make sure that you keep staying in Congress and doing the good fight that you're doing. And, thank God it's not me and it's you. And I will take back and resonate like this message to everyone that we need to be involved in what you guys actually want to take to the next level. So thank you so very much. Thank you, Tim and Allison, for sharing your story. That's fundamentally important. Healthcare is not about money in the conversational sense. It's about Tim, but Tim doesn't exist without the money to keep our Congress people in office and to actually ensure that they can do what they need to do. So thank you. Bye.
Thank you. Bye.